Question 1. The nurse has established a goal to maintain intracranial pressure, ICP, within the normal range for a client who had a craniotomy 12 hours ago. What should the nurse do? Select all that apply. 1. Encourage the client to cough to expectorate secretions. 2. Elevate the head of the bed 15 to 20 degrees. 3. Contact the HCP if ICP is greater than 15 mm of mercury. 4. Monitor neurologic status using the Glasgow Coma Scale. 5. Stimulate the client with active range of motion exercises. Answer. 2, 3, 4. The nurse should maintain ICP by elevating the head of the bed 15 to 20 degrees and monitoring neurologic status. An ICP greater than 15 mm of mercury with 20 to 25 mm of mercury as upper limits of normal indicates increased ICP, and the nurse should notify the HCP. Coughing and range of motion exercises will increase ICP and should be avoided in the early postoperative stage. Question 2. What should the nurse do first when a client with a head injury begins to have clear drainage from the nose? 1. Compress the nares. 2. Tilt the head back. 3. Collect the drainage. 4. Administer an antihistamine for postnasal drip. Answer 3. The clear drainage must be analyzed to determine whether it is nasal drainage or CSF. The nurse should not give the client tissues because it is important to know how much leakage of CSF is occurring. Compressing the nares will obstruct the drainage flow. It is inappropriate to tilt the head back, which would allow the fluid to drain down the throat and not be collected for a sample. It is inappropriate to administer an antihistamine because the drainage may not be from postnasal drip. Question 3. A client has clear fluid leaking from the nose following a basilar skull fracture. Which finding would alert the nurse that cerebrospinal fluid is present? 1. Fluid is clear and tests negative for glucose. 2. Fluid is grossly blood in appearance and has a pH of 6. 3. Fluid clumps together on the dressing and had a pH of 7. Fluid separates into concentric rings and tests positive for glucose. Answer 4. Leakage of cerebrospinal fluid from the ears or nose may accompany basilar skull fractures. CSF can be distinguished from other body fluids because the drainage will separate into bloody and yellow concentric rings on dressing material, called a halo sign. The fluid also tests positive for glucose. Question 4. The nurse is assigned to care for a client with complete right-sided hemiparesis from a stroke. Which characteristics are associated with this condition? Select all that apply. 1. The client is aphasic. 2. The client has weakness on the right side of the body. 3. The client has complete bilateral paralysis of the arms and legs. 4. The client has weakness on the right side of the face and tongue. 5. The client has lost the ability to move the right arm but is able to walk independently. 6. The client has lost the ability to ambulate independently, but is able to feed and bathe himself or herself without assistance. Answer 1, 2, 4. Hemiparesis is a weakness of one side of the body that may occur after a stroke. It involves weakness of the face and tongue, arm, and leg on one side. These clients are also aphasic, unable to discriminate words and letters. They are generally very cautious and get anxious when attempting a new task. Complete bilateral paralysis does not occur in hemiparesis. The client with right-sided hemiparesis has weakness of the right arm and leg and needs assistance with feeding, bathing, and ambulating. Question 5. The nurse has instructed the family of a client with stroke who has homonymous hemianopsia about measures to help the client overcome the deficit. Which statement suggests that the family understand the measures to use when caring for the client? 1. We need to discourage him from wearing eyeglasses. 2. We need to place objects in his impaired field of vision. 3. We need to approach him from the impaired field of vision. 4. We need to remind him to turn his head to scan the lost visual field. Answer is 4. Homonymous hemianopsia is loss of half of the visual field. The client with homonymous hemianopsia should have objects placed in the intact field of vision, and the nurse also should approach the client from the intact side. The nurse instructs the client to scan the environment to overcome the visual deficit and does client teaching from within the intact field of vision. The nurse encourages the use of personal eyeglasses, if they are available. Question 6. What is the expected outcome of thrombolytic drug therapy for stroke? 1. Increased vascular permeability. 2. Vasoconstriction. 3. Dissolved emboli. 4. Prevention of hemorrhage. Answer is 3. Thrombolytic enzyme agents are used for clients with a thrombotic stroke to dissolve emboli, this re-establishing cerebral perfusion. They do not increase vascular permeability, cause vasoconstriction, or prevent further hemorrhage. Question 7. The nurse sees a client walking in the hallway who begins to have a seizure. What should the nurse do in order of priority from first to last? All options must be used. 1. Maintain a patent airway. 2. Record the seizure activity observed. 3. Ease the client to the floor. 4. Obtain vital signs. Answer. 3, 1, 4, 2. To protect the client from falling, the nurse first should ease the client to the floor. It is important to protect the head and maintain a patent airway since altered breathing and excessive salivation can occur. The assessment of the postictal period should include level of consciousness and vital signs. The nurse should record details of the seizure once the client is stable. The events preceding the seizure, timing with descriptions of each phase, body parts affected and sequence of involvement, and autonomic signs should be recorded. Question 8. The nurse is instituting seizure precautions for a client who is being admitted from the emergency department. Which measures should the nurse include in planning for the client's safety? Select all that apply. 1. Padding the side rails of the bed. 2. Placing an airway at the bedside. 3. Placing the bed in the high position. 4. Putting a padded tongue blade at the head of the bed. 5. Placing oxygen and suction equipment at the bedside. 6. Flushing the intravenous catheter to ensure that the site is patent. Answer is 1, 2, 5, 6. Seizure precautions may vary from agency to agency, but they generally have some common features. Usually, an airway, oxygen, and suctioning equipment are kept available at the bedside. The side rails of the bed are padded, and the bed is kept in the lowest position. The client has an intravenous access in place to have a readily accessible route if anti-seizure medications must be administered, and as part of the routine assessment the nurse should be checking the patency of the catheter. Question 9. The nurse is caring for a client who has undergone a craniotomy and has a supratentorial incision. The nurse should place the client in which position postoperatively? 1. Head of bed flat, head and neck midline. 2. Head of bed flat, head turned to the non-operative side. 3. Head of bed elevated 30 to 45 degrees, head and neck midline. 4. Head of bed elevated 30 to 45 degrees, head turned to the operative side. Answer is 3. After a supratentorial surgery, the head is kept at a 30 to 45 degree angle. The head and neck should not be angled either anteriorly or laterally but rather should be kept in a neutral, midline, position. This promotes venous return through the jugular veins, which will help prevent a rise in intracranial pressure. Question 10. A nurse is evaluating an acutely ill client with suspected meningitis. The nurse should take what action first? 1. Check for Kernig's and Brudzinski's signs. 2. Establish IV access. 3. Place the client on droplet precautions. 4. Prepare the client for lumbar puncture. Answer is 3. Place the client on droplet precautions. The client with suspected bacterial meningitis should be placed on droplet precaution isolation until the causative agent has been identified and appropriate treatment is initiated. Meningococcal meningitis and Haemophilus influenzae type B meningitis are highly transmissible to others, and the client must remain on droplet isolation until these can be ruled out. Question 11. 4 children are brought to the emergency department. Which child should be assessed first? 1. A 13-month-old who ingested an unknown quantity of children's multivitamins. 2. A 15-month-old with a fever of 100.5 F, 38.1 C, after being vaccinated. 3. A 3-year-old with a forehead laceration and colorless nasal drainage. 4. A 4-year-old with enlarged tonsillar lymph nodes who is crying in pain. Answer is 3. Clear, colorless fluid draining from the nose or ears after head trauma is suspicious for cerebrospinal fluid, CSF, leakage, option 3. When the drainage is clear, dextrose testing can be used to determine if the drainage is CSF. However, the presence of blood would make this test unreliable as blood also contains glucose. Question 12. A client comes to the emergency department with diplopia and recent onset of nausea. Which statement by the client would indicate to the nurse that this is an emergency? 1. I am very tired, and it's hard for me to keep my eyes open. 2. I don't feel good, and I want to be seen. 3. I have not taken my blood pressure medicine in over a week. 4. I have the worst headache I've ever had in my life. Answer is 4. A ruptured cerebral aneurysm is a surgical emergency with a high mortality rate. Cerebral aneurysms are usually asymptomatic unless they rupture. They are often called silent killers, as they may go undetected for many years before rupturing without warning signs. The distinctive description of a cerebral aneurysm rupture is the abrupt onset of the worst headache of my life. That is different from previous headaches, including migraines. Question 13. A client is admitted to the hospital for severe headaches. The client has a history of increased intracranial pressure, ICP, which has required lumbar punctures to relieve the pressure by draining cerebrospinal fluid. The client suddenly vomits and states, "That's weird, I didn't even feel nauseated." Which action by the nurse is the most appropriate? 1. Document the amount of emesis. 2. Lower the head of the bed. 3. Notify the healthcare provider, HCP. 4. Offer anti-nausea medication. Answer is 3. Unexpected and projectile vomiting without nausea can be a sign of increased ICP, especially in the client with a history of increased ICP. The unexpected vomiting is related to pressure changes in the cranium. The vomiting can be associated with headache and gets worse with lowered head position. The most appropriate action is to obtain a full set of vital signs and contact the HCP immediately. Question 14. An adult client with altered mental status and fever has suspected bacterial meningitis with sepsis. Blood pressure is 80/60ths of a millimeter Hg. Which prescribed intervention should the nurse implement first? 1. Administer IV antibiotics. 2. Infuse bolus of IV normal saline. 3. Prepare to assist with lumbar puncture. 4. Transport client for head CT scan. Answer is 2. Meningitis is an inflammation of the meninges covering the brain and spinal cord. The key clinical manifestations of bacterial meningitis include fever, severe headache, nausea, vomiting, and nuchal rigidity. Other symptoms include photophobia, altered mental status, and other signs of increased intracranial pressure, ICP. Question 15. A client with a brain tumor is admitted for surgery. The healthcare provider prescribes levetiracetam. The client asks why. What is the nurse's response? 1. It destroys tumor cells and helps shrink the tumor. 2. It prevents seizure development. 3. It prevents blood clots in legs. 4. It reduces swelling around the tumor. Answer is 2. Levetiracetam, Keppra, is a medication often used to treat seizures in various settings. It has minimal drug-drug interactions compared to phenytoin and is often the preferred anti-epileptic medication. Question 16. 1. When assessing a patient with newly diagnosed trigeminal neuralgia, the nurse will ask the patient about A. Triggers that lead to facial pain. B. Visual problems caused by ptosis. C. Poor appetite caused by a loss of taste. D. Decreased sensation on the affected side. Answer is D. Rationale. The major clinical manifestation of trigeminal neuralgia is severe facial pain that is triggered by cutaneous stimulation of the nerve. Ptosis, loss of taste, and numbness are not characteristics of trigeminal neuralgia, although ptosis and numbness may occur after therapy, and poor appetite may be associated with pain stimulated by eating. Question 17. During assessment of the patient with a recurrence of symptoms of trigeminal neuralgia, the nurse should A. Examine the mouth and teeth thoroughly. B. Have the patient clench and relax the jaw and eyes. C. Identify trigger zones by lightly touching the affected side. D. Gently palpate the face to compare skin temperature bilaterally. Correct answer. A. Rationale. Oral hygiene is frequently neglected because of fear of triggering facial pain. Having the patient clench the facial muscles will not be useful because the sensory branches of the nerve are affected by trigeminal neuralgia. Light touch and palpation may be triggers for pain and should be avoided. Question 18. A patient with trigeminal neuralgia has a glycerol rhizotomy. During a follow-up visit after the rhizotomy, the nurse will evaluate that the patient has had a successful outcome for the surgery if the patient A. Uses an eye shield at night to protect the cornea from injury. B. Develops and implements a daily routine of facial exercises. C. Is careful to chew foods on the unaffected side of the mouth. D. Talks about enjoying social activities with family and friends. Correct answer. D. Rationale. Because withdrawal from social activities is a common manifestation of trigeminal neuralgia, enjoyment of social activities indicates successful reduction of symptoms. Glycerol rhizotomy does not damage the corneal reflex or motor functions of the trigeminal nerve, so there is no need to use an eye shield, do facial exercises, or take precautions with chewing. Question 19. When the nurse is planning care for a hospitalized patient who is experiencing an acute episode of trigeminal neuralgia, an appropriate action to include is A. Teach facial and jaw relaxation techniques. B. Assess intake and output and dietary intake. C. Apply ice packs for no more than 20 minutes. D. Spend time at the bedside talking with the patient. Correct answer. B. Rationale. The patient with an acute episode of trigeminal neuralgia may be unwilling to eat or drink, so assessment of nutritional and hydration status is important. Because stimulation by touch is the precipitating factor for pain, relaxation of the facial muscles will not improve symptoms. Application of ice is likely to precipitate pain. Question 20. When teaching patients who are at risk for Bell's palsy because of previous herpes simplex infection, which information should the nurse include? A. You should call the doctor if pain or herpes lesions occur near the ear. B. Treatment of herpes with antiviral agents will prevent development of Bell's palsy. C. Medications to treat Bell's palsy work only if started before paralysis onset. D. You may be able to prevent Bell's palsy by doing facial exercises regularly. Correct answer. A. Rationale. Pain or herpes lesions near the ear may indicate the onset of Bell's palsy, and rapid corticosteroid treatment may reduce the duration of Bell's palsy symptoms. Question 21. 6. A patient with Bell's palsy refuses to eat while others are present because of embarrassment about drooling. The best response by the nurse to the patient's behavior is to A. Respect the patient's desire and arrange for privacy at mealtimes. B. Offer the patient liquid nutritional supplements at frequent intervals. C. Discuss the patient's concerns with visitors who arrive at mealtimes. D. Teach the patient to chew food on the unaffected side of the mouth. Correct answer. A. Rationale. The patient's desire for privacy should be respected to encourage adequate nutrition and reduce patient embarrassment. Liquid supplements will reduce the patient's enjoyment of the taste of food. It would be inappropriate for the nurse to discuss the patient's embarrassment with visitors unless the patient wishes to share this information. Chewing on the unaffected side of the mouth will enhance nutrition and enjoyment of food but will not decrease the drooling. Question 22. 7. A patient with Guillain-Barré syndrome asks the nurse what has caused the disease. In responding to the patient, the nurse explains that GBS A. Results from an acute infection and inflammation of the peripheral nerves. B. Is due to an immune reaction that attacks the covering of the peripheral nerves. C. Is caused by destruction of the peripheral nerves after exposure to a viral infection. D. Results from degeneration of the peripheral nerve caused by viral attacks. Correct answer. B. Rationale. Guillain-Barré syndrome is believed to result from an immunologic reaction that damages the myelin sheath of the peripheral nerves. Acute infection or inflammation of the nerves is not a cause. The peripheral nerves are not destroyed and do not degenerate. Question 23. 8. A 24-year-old patient is hospitalized with the onset of Guillain-Barré syndrome. During this phase of the patient's illness, the most essential assessment for the nurse to carry out is A. Monitoring the cardiac rhythm continuously. B. Determining the level of consciousness Q2 hour. C. Evaluating sensation and strength of the extremities. D. Performing constant evaluation of respiratory function. Correct answer. D. Rationale. The most serious complication of Guillain-Barré syndrome is respiratory failure, and the nurse should monitor respiratory function continuously. The other assessments will also be included in nursing care, but they are not as important as respiratory assessment. Question 24. 9. When caring for a patient who has Guillain-Barré syndrome, which assessment data obtained by the nurse will require the most immediate action? A. The patient complains of severe tingling pain in the feet. B. The patient has continuous drooling of saliva. C. The patient's blood pressure, BP, is 106/50ths of a millimeter Hg. D. The patient's quadriceps and triceps reflexes are absent. Correct answer. B. Rationale. Drooling indicates decreased ability to swallow, which places the patient at risk for aspiration and requires rapid nursing and collaborative actions such as suctioning and possible endotracheal intubation. Question 25. A patient who has numbness and weakness of both feet is hospitalized with Guillain-Barré syndrome. The nurse will anticipate that collaborative interventions at this time will include A. Intubation and mechanical ventilation. B. Insertion of a nasogastric, feeding tube. C. Administration of methylprednisolone, solumedrol. D. IV infusion of immunoglobulin, sandoglobulin. Correct answer. D. Rationale. Because the Guillain-Barré syndrome is in the earliest stages, as evidenced by the symptoms, use of high-dose immunoglobulin is appropriate to reduce the extent and length of symptoms. Question 26. A patient admitted to the emergency department is diagnosed with botulism, and an order for botulinum antitoxin is received. Before administering the antitoxin, it is most important for the nurse to A. Obtain baseline vital signs. B. Administer an intradermal test dose. C. Ask the patient about a history of allergies. D. Document the presence of neurologic symptoms. Correct answer. B. Rationale. To prevent allergic reactions, an intradermal test dose of the antitoxin should be administered. Question 27. A patient arrives at an urgent care center with a deep puncture wound after stepping on a nail that was embedded in some old lumber in a field. The patient reports having had a tetanus booster 7 years ago. The nurse will anticipate A. IV infusion of tetanus immune globulin, TIG. B. Initiation of the tetanus diphtheria immunization series. C. Intradermal injection of an immune globulin test dose. D. Administration of the tetanus diphtheria, TD, toxoid booster. Correct answer. D. Rationale. If the patient has not been immunized within 5 years, administration of the TD booster is indicated because the wound is deep. Immune globulin administration is given by the IM route if the patient has no previous immunization. Question 28. A patient with a neck fracture at the C5 level is admitted to the intensive care unit, ICU, following initial treatment in the emergency room. During initial assessment of the patient, the nurse recognizes the presence of spinal shock on finding A. Hypotension, bradycardia, and warm extremities. B. Involuntary, spastic movements of the arms and legs. C. The presence of hyperactive reflex activity below the level of the injury. D. Flaccid paralysis and lack of sensation below the level of the injury. Correct answer. D. Rationale. Clinical manifestations of spinal shock include decreased reflexes, loss of sensation, and flaccid paralysis below the area of injury. Question 29. When caring for a patient who had a C8 spinal cord injury 10 days ago and has a weak cough effort, bibasilar crackles, and decreased breath sounds, the initial intervention by the nurse should be to A. Administer oxygen at 7 to 9 L per minute with a face mask. B. Place the hands on the epigastric area and push upward when the patient coughs. C. Encourage the patient to use an incentive spirometer every 2 hours during the day. D. Suction the patient's oral and pharyngeal airway. Correct answer. B. Rationale. The nurse has identified that the cough effort is poor, so the initial action should be to use assisted coughing techniques to improve the ability to mobilize secretions. Administration of oxygen will improve oxygenation, but the data do not indicate hypoxemia, and oxygen will not help expel respiratory secretions. The use of the spirometer may improve respiratory status, but the patient's ability to take deep breaths is limited by the loss of intercostal muscle function. Suctioning may be needed if the patient is unable to expel secretions by coughing but should not be the nurse's first action. Question 30. As a result of a gunshot wound, a patient has an incomplete right spinal cord lesion at the level of T7, resulting in Brown-Séquard syndrome. Which nursing action should be included in the plan of care? A. Assessment of the patient for left leg pain. B. Assessment of the patient for left arm weakness. C. Positioning the patient's right leg when turning the patient. D. Teaching the patient to look at the left leg to verify its position. Correct answer. C. Rationale. The patient with Brown-Séquard syndrome has loss of motor function on the ipsilateral side and will require the nurse to move the right leg. Pain sensation will be lost on the patient's left leg. Left arm weakness will not be a problem for a patient with a T7 injury. The patient will retain position sense for the left leg.